Hello, Professor. My name is Cynthia Ozoji, CYNTHIA-OZOJI. Here's my ID card. This is my video presentation for the GI and cardiovascular system. Here's my client. I have a permission to film this video. Her script is empty and there's nothing in my environment. I would indicate the moment I start my timer. Okay, I'm starting my timer now. Hi, my name is Cynthia. I'll be your nurse for today. Can I see your armband, please? What would you prefer I call you?
Jane.
Okay, Jane, what brings you in today?
Just an abdominal pain.
Okay, Jane, I'll be carrying out a series of assessments. Usually it will take 5 to 7 minutes, after which I'll be telling the doctor about my findings. Do I have a permission to carry out this assessment? Also, is there anyone you feel comfortable sharing this information with? Okay. From the vital signs given to me, my patient's temperature is elevated, her heart rate is elevated, her respiratory rate is elevated. However, her blood pressure is okay. So Jane, which might indicate infection. Jane, do you mind telling me if you're experiencing shortness of breath?
I don't think so.
Chest pain?
I have an ache in my upper chest.
Dizziness?
I just feel tired.
Edema?
No.
Abdominal pain?
I have a stomach ache.
Do you have any food intolerances?
Spicy food.
Nausea and vomiting?
I am nauseous and I did vomit once.
How is your bowel movement?
Normal.
Okay. You said you had pain. Do you mind telling me the onset of the pain?
At 8 a.m. this morning.
Is it palliative?
I don't know.
What provokes the pain?
It happened after breakfast.
Does it radiate?
Sometimes down my arm.
What region do you feel this pain?
Right under my breast, like at the middle of my chest.
Okay, what's the quality of the pain?
My stomach and my upper chest are just achy.
Can you tell me the timing or frequency?
Constant.
What about the frequency of the pain? On a scale of 1 to 10?
8 out of 10 in my stomach area and 5 out of 10 in my chest area.
Did you take anything for the pain?
I tried to take some aspirin, but it did not work, and then I laid down for an hour, but it did not go away.
Do you understand what caused this pain?
Am I having a heart attack?
We'll find out from the assessment, okay? I'll be inspecting my client. Upon inspection, I can see that she's comfortable. There's no, her skin looks well flushed and moist, and there's no use of accessory muscles such as the jugular vein, no increased work of breathing, there's no dyspnea with walking or breathing. From her abdomen looks bilaterally symmetrical. There is no striae lesions. However, there are scarring from previous surgery such as the hysterectomy and the removal of her gallbladder. So I'll go ahead and auscultate. I'll be palpating first my patient's pulse points. Also, I can see pulsations on her pulse points, aortic pulsations. So I'll be palpating her pulse points: carotid, brachial, radial, femoral, dorsalis pedal. Then I'll be checking her capillary refill on her toes without the socks, of course, and on her hands. Her capillary refill are less than 2, which is normal, and then her pulse points are elevated. So I'll go ahead and auscultate her chest region using the diaphragm of the stethoscope to listen to normal heart sounds and murmurs, which can be swooshing sounds, starting from the aortic to the pulmonic, herbs, tricuspid, mitral. Then I'll be using the bell of the diaphragm to listen for abnormal heart sounds, also for bruits, using the same technique. Okay, I can hear murmurs upon auscultation. I'll go ahead and auscultate her abdomen, starting from I'll be using the bell to auscultate the abdomen so I can hear all the sounds, starting from the right lower quadrant. Here we have the appendix. I'll be listening in 3 different areas. In the right upper quadrant, we have the liver. The left upper quadrant, we have the stomach. And in the left lower quadrant, we have the descending colon. So I can hear normal bowel sounds, and then my patient's stomach is flat, well-rounded. I'll be palpating using 3 fingers, and I'll be palpating 1 to 2 centimeters depth in a circular motion. Let me know if you feel any pain, okay?
Okay. It's somewhere there.
Okay, I'm sorry. Okay, upon palpation, I can feel normal abdominal organs. However, there's pain in the upper epigastric region. I'll go ahead and call the doctor to let him know about my findings. Green. Hello, doctor. This is Cynthia calling from the ER. I'm calling with regards to my patient, Jane, a 63-year-old woman. She came in with pain in her chest region and her upper epigastric region. She stated she had an episode of vomiting this morning. However, she's comfortable. There's no edema, but I can see but from her history, she has a history of type 2 diabetes, hyperlipidemia, and osteoarthritis, and then she has some incisions from past surgery, such as the removal of her gallbladder. Also, from assessment, she has elevated heart rate, and then she also has pain in her upper epigastric region, and then she's there's no edema and there's no diaphoresis. Comfort measures have been provided. However,